The biggest thing that hunters can do is, number one, stopping at our check stations. Hunters are an integral part of this. We need to get as many hunter harvested animals as we can to test for chronic wasting disease.
I'm going to take a sample from the throat.
In different years, we'll be sampling in different locations. So there really won't be anything different as far as what hunters are used to. That we'll have our check stations out there, and folks are just going to need to be patient. If we're sampling in your area, we're going to need to get as many lymph nodes from the animals that we can.
First lymph node is right here. The disease will show up in the lymph node first, and it will progress through deer in a way that it will then house itself in the obex, which is the brainstem. So that's why we take all the information, his tag number, location, age of the animal, species, because we want to be able to find what location we detected it at in the state, and we also want to be able to tell the hunter that we found chronic wasting disease in his animal.
Okay, I'm gonna pull her out.
We definitely want hunters to get their animals tested, particularly in places like Unit 14 and the surrounding units where we know we have CWD. In the rest of the state, the risk is very low. We do have a sampling strategy that we want to get to in terms of the number of samples.
Check stations alone will not be enough to get the sample numbers needed. So for those areas in the yearly rotation, Idaho Fish and Game asks hunters who do not pass through a check station to voluntarily bring in their adult deer heads to Fish and Game offices. The staff will then remove the lymph nodes.
We need heads that have a little bit of throat in them. So if they'll feel for the hard cartilage in the throat and cut just beneath it, and then bring in the rest of the head, that would be perfect. They can bring it to any regional office. We are requesting samples from adults and yearlings. Fawns are a little too young to have detected it, and for us, for the prion to have been built up in the body.
Anytime a hunter, or not even a hunter, any citizen for that matter, if they do see a sick animal, something doesn't look right, they should call us immediately, and we'll come out and assess the situation. The probability of a sick animal having CWD is much higher than just animals randomly harvested, so those are going to be critically important moving forward.